much for availing yourself this afternoon. So what informed this decision or recommendation, if you will?
Okay, thanks for having me. I'd like to say that the first consideration that informed this recommendation for countries to lift the travel ban is that it has proven not to be effective. You will recall that a number of countries that were quick to impose travel bans on South Africa and some other countries where Omicron was first reported. Eventually found that there were cases of Omicron right within their borders. So the blanket travel bans has indeed proven not to be effective as a measure in stalling the spread of the pandemic. And this is the first and primary consideration for the recommendation. Again, I like to say that this is a disincentive for countries, and this is against what WHO is trying to promote. We are trying to promote a transparent system of surveillance and of information sharing. And so a situation where you place restrictions or punitive measures on countries that are able to share information in a timely manner, that translates to disincentivizing other countries from following what I would call a good example. And lastly, let me just say that this is also not in line with the recommendations of the IHR, and indeed translates to a discouragement for countries to actually do the proper thing. Thank you.
A discouragement for countries to do the proper thing. Those who do not necessarily believe in this recommendation or would follow this recommendation, what disadvantages does the World Health Organization perceive there'd be for these countries?
Thank you. Again, placing travel bans on countries amounts to disruptions in economic activities, in trade, in livelihoods. Some of these have negative impacts on the economies of families and populations of these countries. And a situation where there is no measure, there is no data, there is no information to suggest the effectiveness of these measures, it becomes a wasted effort, more so when the primary consideration, the primary outcome that you want to avert eventually becomes what you experience. So we find that there is no need to disrupt economic activities or to impact negatively on the economies of families without a science behind the thought.
The African continent led the way, if you will, at the height of the Omicron variant breaking out. President Cyril Ramaphosa of South Africa embarked on a trip to West Africa, and those nations not closing their doors, save for a few countries on the continent that actually barred Southern African nations from traveling to their countries. The continent was pretty much open. What lessons can the world draw from Africa?
Yeah, thanks. And really, it's my pleasure to say that there's no time better than now to be proud of being African. I like to say that the lessons that can be drawn from the African continent are in their bounds. Let's start firstly with the stronger surveillance systems that we have seen developed over time, complemented by early reporting, transparent information sharing. I think that these are best practices that are worthy of emulation. Again, we have seen effective information sharing and surveillance mechanism even at the community level, at the very primary community level. Now it is possible in Africa for an alert to come from the remotest part of the villages or the communities. So I think that this is a development in the right direction and is worthy of emulation. I've mentioned the aspect of information sharing, but also another interesting part is the aspect of cross-collaboration. So for Africa, one country is not saying, country A, it is your problem, or country B, this is not us, you are the ones experiencing the pandemic. We have seen different levels of cross-country collaboration. Let me tell you, for example, that South Africa had been able to, apart from being one of the first countries to report the isolation of the new variant, Omicron, South Africa had played a major role in serving as some sort of sub-regional hub for genomic surveillance activities or genomic sequencing activities for neighboring countries that have relatively less capacity. This is the kind of collaboration we are trying to promote across member states, and this is the kind of development we like to see. And lastly, I think it will not be fair if I do not mention the role of member states. More than ever before, we have been able to see governments of member states establish measures that help to control the spread of the pandemic. But not just that, also galvanizing compliance at the very community level. At some point, or at the inception, we could say that there was limited trust, but over the time, over the months, over the years, what we are beginning to see is that there is greater demand for the correct information. People want to know, what do we need to do to keep safe? And I think that this is a good outcome of the efforts of governments of member states. Thank you.
Indeed. Dr. Ejiofor, I do beg your indulgence. A number of, or some sectors of society, not just, in South Africa, not just across the world, but, across the continent, are getting edgier and edgier, or pantsy, if you will, in terms of lockdown restrictions. Does the World Health Organization have a position on what countries should do with regards to restrictions?
Well, I would like to say that for WHO, the recommendation remains a risk-based approach to imposing these restrictions or these measures. This means that we have to be more open in sharing information that helps us appraise, to a great extent, to a great precision, the risks posed by either the pandemic or the measures that we want to put in place. So, while there is no direct position, and while the recommendations will on context and the risks, therein, I think that what is important to have at the back of our mind is that it will be contextual. For situations where governments determine that certain measures have to be put in place based on available information and based on science, on logic, on information and data that is available, then WHO is more than happy to provide support to countries to be able to implement those measures.
Dr. Nonso Ejiofor is from the World Health Organization's Regional Office for Africa, joining us there from Brazzaville, that's in Congo Republic. Thank you for availing yourself this afternoon.